So welcome everyone. We've got our speakers lined up here, so I'm going to give you a short introduction. We've got quite a lot to get through. And then I'm going to hand over to Becky James, who's going to tell you about the development of the Learning Set and what you can find there. And then we've got speakers as well from Cumbria to tell us a little bit about health champions in their locality. So hopefully you get a good mix of kind of policy and practice in this session. So a couple of notes on housekeeping. I say we're recording this session. We'll share the link to the recording afterwards. Just so we get through everything, if we could keep questions to the end or drop them in the chat, that'd be fine. If we can't answer anything today, then we'll try and get you an answer and pick it up on the email when we follow up. If you could just keep your microphones muted, that would be great, just to keep it a good quality for everyone. And we will follow up with an email with the slides and with a link to the recording and anything else that we think you might like to know about. Okay. Let me just spend a couple of minutes just putting this work in context. So this next slide just shows you the structure of the healthier and fairer work, and this forms part of. I'm not going to try and describe everything in this slide, but just to let you know, it is part of that bigger picture of work on health inequalities funded by the ICB, and is part of our partnership working with the ICB as part of our integrated care system. On the next slide, I'm not going to read all of these, but these are our objectives for our Healthy Communities and Social Prescribing programme. And really, it's about promoting integration, and it's about investing in community-led, community asset-based approaches. And that's where the Health Champions forms part of that work. So we're all about investing in social prescribing and grassroots community support for people to improve their health and well-being. And the next slide just shows you some of the other programs that are going on as part of that work. We're investing a lot of money, the ICB is investing a lot of money at place in building capacity of social prescribing. We're doing that with the help of partners, other infrastructure organisations and charities, to get money to grassroots level. And we have some of the key projects there as well. So that's just to set a little bit of context as to where this is coming from. And now I'm going to hand over to Becky, who will tell you more about the Health Champions work and the Learning Set.
Thanks, Richard. So, morning, everybody. My name is Becky James. I'm a Health and Wellbeing Programme Manager for the Office for Health Improvement and Disparities in the North East. So I have a regional role around health inequalities and community-centred approaches, which is obviously where the Community Champions work sits. So next slide, please. Just going to provide a few slides around the Learning Set and just some of the regional work that we're doing around the Community Champions approaches. Just a couple of slides around some of the context around this work. So community champions or health champions are members of community who volunteer to promote health and well-being, and they use their social networks to support the sharing of information, address barriers to services and access, and provide that really valuable insight and intelligence to inform and shape local plans and programmes. Next slide, please. And there's really strong evidence base around the use of champion-led programmes and these kind of peer-led approaches around tackling health inequalities, engaging those communities with the greatest need and those that are furthest away from accessing services and support, and really empowering people within their communities. And the COVID pandemic really shone a spotlight on the use of champion approaches, with many examples of good practice, and provided a great opportunity for local people to really engage in these champion programmes to support both the response and recovery efforts. Next slide, please. I think across the northeast and North Cumbria, there's lots of activity that's been happening in this space. Obviously, champion programs are not a new concept, and we've always, as a region, done really kind of great work around asset-based approaches. And I think, you know, this is just about really kind of shining a spotlight on some of that and kind of building on what we've already got. And next slide, please. So in terms of a regional programme of work, the North East North Cumbria put a successful bid in 2021 for NHS England Connectors funding, which was for ICS areas to support connectors or champions activity, which was very much linked to the Core 20+5, which I'll talk about in a further slide. So linked to that priority. And our programme of work in the North East North Cumbria was, like I say, to build on the existing champion work, which was already established in every area across the region. So it wasn't about starting something new. It was about really building on what we've already got. So we used this funding to host a dedicated program manager post, which was hosted by VONNE, which really provided that kind of dedicated capacity to work with the local authorities and the existing champion programs and kind of build a regional approach to this. We have a network which I chair, which is a bi-monthly network to bring together all of the local authority champion leads, which is a real kind of space to learn, share and explore opportunities where we can kind of collaborate around regional working, which, like I say, just kind of adds value to the work that's already happening. This has also seen peer-led work between different areas, and then work with other partners across the system to explore the use of champion-led approaches. And the next slide, please. So obviously what this webinar is about, and one of the key products of this work has been the development of a learning set to really kind of capture all of this practice and the different approaches across the region that's come about from COVID and broader kind of health topics and work that was already in place and sort of beyond COVID, to bring it into one resource to share across the system and really inform future work that we look to do around champion-led work. So we'll share the link possibly in the chat now, but certainly after the webinar, where you can all kind of look in more detail at this. But I'm just going to provide over the next few slides just a quick overview of the content of what the learning set has in it. On the next slide. So just to note that obviously the bringing together all of this information wouldn't have been possible without the input, the information and the different examples from our local authorities across the region and a range of different partners. And this is very much a partnership approach to doing all of this work. And the next slide. And really the kind of purpose of bringing this together was to provide an online repository of information, of different examples, resources and things that we can kind of share as that kind of partnership approach. We want it to be a live resource so that we're kind of adding to it all the time in terms of case study examples once we do kind of further work in this space, and really use this. And this kind of webinar is the first bit in terms of that conversation around using this learning to inform further work. And, you know, like I've said already, it's really about building on what we already know and sort of using this as a bit of a knowledge exchange. And it also provides a summary of what's happening in each area, kind of recognizing that these approaches really happen best recognizing the needs of each kind of local community, and there is kind of no one size fits all approach. So there's a summary of kind of how that happens in each local authority area. Next slide, please. So within the resource, there's kind of 4 main themes in terms of how the information, the practice examples are set out. Each with kind of clickable links and resources supported by the key learning from each of the local approaches. So the first one is around how to kind of engage and communicate with champions. So this covers things like establishing the programme in the first place, how to recruit champions, information around induction processes, how to engage diverse communities through these champion approaches, and that sort of ongoing communication with champions. And I guess the kind of idea of kind of capturing and bringing all this information together is to sort of share that with different areas and different kind of topics across the system around, you know, how to best do this, and to sort of share some of this learning and share kind of actually what works well and some of the challenges and things that haven't worked as well, so that again, you know, we're not kind of starting things from scratch all the time. And the next slide. And the second key theme is around training. So kind of the types of information that's been shared to kind of upskill champions to be confident to have conversations about different topics. A wealth of different kind of resources around different training topics, things like conversation starters for champions, and then a specific kind of slide around topic specific examples of practice. And the next slide. Then around sort of monitoring and evaluating programs, I think this is one of the key kind of challenges, I guess, that we've discussed a lot within our sort of regional group. It's actually really hard to kind of monitor the impact of these approaches. So kind of sharing some of the examples of practice around that, how to monitor and evaluate the reach of these approaches, how to kind of capture some of the individual stories and the impact both of the champions' involvement themselves and then the impact that has on others, and some of the range of the different kind of evaluation tools that can be used. And the next slide. And then the final kind of key theme is around how to sustain champion programs. So I think, like, particularly thinking about COVID, that really provided that opportunity to engage people as champions, but it's kind of thinking about how we move that on into broader health and wellbeing topics, and recognizing that actually these programs don't just happen. It takes a lot of resource and capacity to kind of keep them going and engage people in a really kind of positive way, recognizing that obviously people give up their time, their free time to do this. So this bit is all around sort of how to build and maintain those relationships, how to embed champion programs into strategic plans locally. Again, like I say, the kind of transition from COVID into mainstream programs, and really support the engagement of champions. Next slide, please. So I mentioned this briefly before around Core 20 plus 5. So the focus of the national funding that we got in 2021 was around Core 20, and this has really been one of the kind of core focuses of our regional programme of work, and really exploring how champion-led programmes could support wider outcomes. So Core 20 plus 5, if you're not familiar with it, is a national directive to tackle health inequalities with a focus on those living in the 20% most deprived neighbourhoods, the plus population, those that are furthest away from engaging and accessing services, and then 5 clinical priorities, 5 for adults and 5 for children and young people. And I think it just provides a kind of nice framework and an opportunity to look at a system approach to using champion approaches to support these objectives. And like I say, it's something that we're keen on doing as part of our regional work. Next slide, please. So appreciate that was a really quick whistle stop tour to highlight some of the key things in the learning set. Kind of really keen for you to have a look through the full document when we share the link. Share it with colleagues who you think might be interested in this, and then really kind of consider how you may use that learning in your own area of work. Really happy for people to get in touch with me around any of this, and we're going to pick up any questions at the end, or feel free to post in the chat. I think some people have, so I'll take a look at them now. And I think I'm going to hand over to Charlotte and Georgina. Is that right? Is that what's coming up next? And this really is just to highlight one. This, we could have picked so many different examples, but this is just, I guess, to kind of bring to life just one example of how this works in practice. So I'll hand over to Charlotte and Georgina.
Thank you very much, Becky. Nice first slide. Thanks very much. So I'm Charlotte, and I'm here with my colleague Georgina, just sharing a bit of insight into our project in the west of Cumbria, and that is around stroke prevention. Just a couple of things to say about. Yeah, so I'm a volunteer coordinator on this project. I wasn't a volunteer. I am now. Came to this through a national NHS England funded programme around supporting work like this, that stemmed from a partnership between NHS Cumbria and the Rotary Club. And Georgina, do you want to say who you are?
Yeah, thanks, Becky and Charlotte, and good afternoon, everybody. And I've had a quick look at the list of attendees, and I'm really heartened to see a few names that I know. They probably don't know me in this context, so yeah, hi. I'm a public health manager with Cumberland Council now. When we started this work, and you'll see the County Council, Cumbria County Council logo on this slide and some of the other slides, because we did start this work quite a wee while ago. My role was the locality public health manager, so I had population health responsibility for the west of the county that Charlotte's talking about. So go on, Charlotte. Are we back to you, or is it me for a bit?
Just a couple of thanks, Georgine. Just a couple of things to say. There's a and thanks for pointing that out about our geography now and how that has changed a little bit. So there's significantly here, there's a number of partners here as well that have played a role that you can see on that slide too. And just to say, whilst some of us are volunteers, some of us aren't as well, and we have found that model of working has been particularly enabling, and we do sometimes talk about it as being community-led NHS and public health enabled. Next slide, please. Georgina, I think if you describe the problem that we started with, that's
sure.
fab.
Yeah, and I think it's fair to say when we started this work, we didn't think of ourselves as champions or creating a champions program or anything like that. We started with a problem. We started with an issue, and it was a combination of an issue for the community, a personal issue for lots of people who are committed to this work. I certainly had a personal connection. My dad died from stroke, and it was awful, absolutely awful. But from an NHS perspective, there were lots of changes going on in the health infrastructure locally. And there was at the West Cumberland Hospital, which sits in the west of the county, there was talk of people who experienced stroke not being treated there. And they would have to travel up to Carlisle, which is about 35 miles or so, an hour on a good day's journey. And, you know, I'm sure we all can understand the potential consequences of delaying any treatment that for clot busting drugs, etc., etc. So it's kind of started like that, and we were aware. I mean, on that slide it says the 10 wards in Copeland with the highest rates of stroke. We were aware that we had in Copeland high levels of stroke, and also, do you want to flick to the next slide? And we also had other risk factors, so, you know, high hospital stays for alcohol related harm, and 1 in 4 adults are not getting enough physical activity, high levels of obesity. I think that's probably on our next slide, isn't it? Do you want to flick to the next slide? Yep. So high levels of obesity in children and adults, and low uptake of the NHS health checks. And one of the things that struck all of us was around 80% of strokes are preventable. And if you just have behaviour change, if you change your lifestyle, if you do something about it, and we were very conscious at the time of pressure. I mean, when's this going back to, Charlotte? Are we talking 2018?
Yes, exactly. 2017, the idea started. 2018, yeah.
So, you know, at that time, COVID wasn't even a twinkle then, was it? So we didn't have any of that on the horizon. We knew about the pressure for services, for health services, for GPs, for acute services, etc. You know, that was the thing. But for those of us who weren't from a clinical background, we kind of felt, well, surely we must be able to do something about it. What can we do about this? And that was where we came from, looking at what can we do about this, and identifying that 80% of strokes are preventable, and also starting to understand that something as simple as an irregular heartbeat, so, you know, AF, atrial fibrillation, was a bit of a ticking time bomb. And there were lots of people out there in the community who had AF, didn't know that they had AF, and that if we could identify that could make a difference. So do you want to move on to the next slide? I think that could come up to you, Charlotte.
Thanks, Georgina. And this gathering together of people with the problem that Georgina's just described to you was how we did it. So it was a very open approach involving lots of different people with a range of skills, experience and influence. So the pictures that you see in front of you are people from the community in Egremont in the west of Cumbria, a more or less a social club really in Egremont. So places where people would come with a bit of lunch to gather people together to look at the problem, share all their skills and ideas. And the next slide, please. See, what really came out from that was this desire to work differently. Exactly as Georgina said, we came together with the problem. What did we want to achieve? Started to think about giving something a go, and then look at the difference that we were making or the impact of that. And we had some really brilliant partners there in that room, and lots of different organisations. Some are listed there, some aren't. And we also had Professor John Howarth from the trust here in Cumbria as well, really supporting us. So we had support, we had champions, different sorts of champions, really. I guess in a way, everybody felt like a champion in those rooms at the very beginning. Moving on, this is just when we started to go out. So we kind of didn't spend too much time. We had an idea, and we all sort of went in, took it into the field, literally a field, I think, actually there. And you can see the Rotary lent us, Health Watch lent us marquees and gazebos, and we had blood pressure testing initially. And you see the Rotary is a big feature there. And this is in various pictures from Whitehaven Traders Fair, actually, of us all coming together as a collaboration, volunteers and NHS, public health, community pharmacy, Northwest Ambulance Service, huge partners there. Thank you. And Georgina, I think if the next couple of slides just explain a little bit about what we found at 2 events, if you could talk through those. So the first one was, this was our first sort of main in the field event, maybe the first, maybe the second, but over to you, Georgina.
Okay, thanks. So I think for a bit of additional context, it's worth sharing that we realised fairly early on that those of us who were non-clinical, we couldn't do the oh, well done, Katrina, spot on. We couldn't do the blood pressure checks because of well, for various reasons that you'll know, the clinical reasons and the risk associated with that, and if we got it wrong, and if the equipment's not working, and who has liability, etc. So who can do that? We can't do this on our own, we realized. But what we did know that we could do was that we could do AF testing. And this is normally the point where I get my little cardia device out, but it's in my handbag, Charlotte, so I haven't got it here, so you'll be disappointed. And I have to share, I'm sure you won't mind me sharing this, but I actually took it to Charlotte's wedding, and I AF tested people at Charlotte's wedding. So that's how committed and dedicated that we are. Anyway, so next had a project on for supplying the cardio devices and training folk. So we undertook training a whole raft of people in the community, and mainly through our library teams, because at that point in 2018-19, we actually had a lot of events going on in our libraries, and we trained our library staff and other members of the Copeland Community Stroke Group to do AF testing. But as Charlotte says, this was our first kind of public foray, and at this session I think we had Professor John Howarth doing the AF, the blood pressure checks at this. It was hard, it was really hard at that time getting clinical staff, really hard. And you wouldn't think that you get a professor to do it, but you know, he was a sponsor for the project, and he said, no, I'll do it, I'll do it, and he came along and did it. And we were able to do the AF checks. So that one gives you an idea. So this is a traders market. It's in the town centre. There's lots of stalls there where you can, you know, buy candles, buy jewellery, buy cheese, buy all that sort of stuff. And there was us with our, you can see, I can see because I've got the it's on the other screen. I can see the photo. Sorry, so apologies. So there we were with our gazebo, and 80 people were seen, and that's the results of the tests that of the people that we've seen. So you can see we've got a great age range, and what we found was lots of people would come and talk to us because we had our volunteers. So when you do stuff like this, people kind of gravitate towards what they're comfortable with. They're volunteers, so they're comfortable with. So I've always been comfortable with doing the AF stuff, so I was happy to do that. But most of our volunteers are comfortable with either filling in our paperwork, our forms, not very onerous, but talking to folk, and making them feel relaxed and making them feel, you know, that they could come. And lots of people came to us that wouldn't go to the GP, wouldn't go to any health professional to actually get the blood pressure checked. And lots of people where it was like, oh, my dad had a stroke, oh, my brother had a stroke, maybe should I? And you were able to encourage them to come up. So out of, I mean, you know, if you're talking about 80 people, we detected in that situation 2 people with AF. And when you look at what data tells us, we reckon that there's around, is it 2% of the population have got AF? So, you know, that was pretty good going. And a number of people referred to pharmacy. So 11 people were referred to the pharmacy there. Do you want to just flick to the next one? And then this was the next one, and this was a different, so 2 different events, one in the town centre and one in a large village out of the town centre, a vintage rally. So attracted people, different cohort of people, a lot of older, a lot of gentlemen, a lot of farmers, a lot of people that you're not going to reach, and 135 people were then checked at that. And again, we had Professor John Howarth, who was there doing our testing for us, and really positive, really good feedback. Charlotte, are we over to you?
Thank you, Georgina. And a few slides coming up now that I'll talk through quite rapidly. That was the point at which after those events where COVID came along, and that's actually a picture of one of our Rotary leads, actually, real champion locally. Next slide, thank you. And we can just go through these. So we adjusted to lockdown and social. We went online on old school. We produced a leaflet, we produced a banner. We were sort of in that stage of kind of, we kept meeting as a group, but we met on Zoom. We met quite frequently, actually, over that period, because we were kind of looking out for each other too. So we kind of morphed into that role of looking after everybody else in our group. We checked in with everybody regularly to see how they were doing, and we did what we could sort of behind the scenes before we could get back out into the public again. So getting our banners sorted, getting our wording sorted. What did we want to say? How did we want to say it? Next slide. I
think it's worth saying that's a really good learning point, because the group could have fell apart, because for all intents and purposes, we couldn't do what we were there to do, because we couldn't get out there, and other things took priority. So I think that's a really good learning point, that actually we held it well. I say Charlotte held us together.
Thanks. And we we just took a bit of time out to reflect on what we were doing, but yeah, kept going, definitely kept going, Georgina. And the next slide, there's a couple here, and they really just build on what Georgina's already been saying. We got back out there. Whitehaven Community Hospital. We spent, sometimes we're there for a day, sometimes we're there for a couple of hours. So for example, in the hospital that morning, we saw 32 people, interestingly, and back to what Georgina said about support for blood pressure testing. We get support. This time we got it in the hospital, so there you can see a nurse there alongside who was supporting us. In fact, she was a stroke ward manager. Supporting us. We tend to get really good responses, particularly from community pharmacy, and in this case from the hospital. So we did this in the foyer of the hospital, so it was for staff, interestingly, staff and visitors alike, and we had some really interesting conversations, as much about conversation in a way as the result. There's a picture here of Egremont Farmers Market, where we are every Friday, a Friday in every month. One of our Rotary volunteers does that, keeps us visible. We don't always have to be doing the checks. Being visible and chatting to people and giving out the flyers and having those conversations feels really important too. And then so we have generally with our results, and as Georgina says, we have quite simple forms that we fill in, and we look at how many people we refer, how many people, if we see high blood pressure, that's something that the clinically led people will talk about in terms of what you need to do. But if there are any that need to be referred, that is usually done through local pharmacy, community pharmacy, who support us as well. So for example, on that day, we saw 32 people in the foyer of that hospital, visitors and staff, and we had one person referred. We weren't doing AF testing at that point, but one person referred for extremely high blood pressure. Next slide. Just whizzing through these a little bit now, just so that there'll be time to chat afterwards if you need to. Here we are back at the Traders Fair. This Traders Fair is really built now. We've become a bit of a fixture, and we're visible there now. It's a regular haunt of ours, and we see approximately about 50 people, between about 10 and 1 people that come up. And now, as Georgina said, we do atrial fibrillation testing as well. And it's common for each time we do it, we may have 1 or 2 referrals for extremely high blood pressure. We work alongside Copeland Wellness Service now in partnership too, so they're able to really support with any referrals or other health information. So in a way, we've become more rounded as well. And moving on from that, the next slide, as Georgina's mentioned, we had some training together. This is our volunteer team here to help us learn how to use the cardio device that we use for AF testing, which Georgina did a great job of helping us to learn about. The local council bought us a printer, a battery operated printer, so that if we did detect AF, that we could print off a trace as well for somebody. So we had to consider lots of things around data protection, not holding any personal data on our own phone devices, all that kind of thing. So all sort of stepped up a little bit from there as well, and we can do more now, which is fantastic. And then just moving on from that. Oh, and Georgina did an amazing thing there. He's got a GP involved to write us a script, and the script we use for AF testing, if we detect AF, a script that we use as well for the different alerts that we can get on the trace. So that's been another partnership with a GP, I think, in Workington, Georgina. So that's been fantastic. Right, yeah. And then Georgina puts us in touch with events and says this would be a good one to go along to. And this is an example of one that you got us to, Georgina. And I think you were just going to say a bit about this, because it was a slightly different group of people, wasn't it? A slightly different sort of event.
It was, and this was a massive health and wellbeing festival. It's been running for, I think it was running COVID. I think this is the 3rd year now. And there were 2,200 people on the day at this event. And if I tell you that we never stopped from the doors opened till the doors closed with folk being AF tested and getting blood pressure tested. It probably helped that we were next to the stall that were giving out the ice cream vouchers for children. So there's a learning point as well. So we were able to have conversations with people, again, different population, and not the older population that we've experienced in other groups, but the health conversations that we were having were really, really interesting, because people are then trusting you. And I had people asking me about statins, for example, and so it enables you to say, well, go and discuss that, get in touch with your practice, discuss that, really, really good session. How many people did we get there, Charlotte? There was a lot, wasn't there?
Yeah, I think.
Did we have to switch off at 50, or did we?
No, I think sometimes we are limited by the person who is doing our BP testing, actually. I think that was about 50, but I think we're limited sometimes by the time that people can give us, because we had a nurse, didn't we, from the wellbeing service from a local practice who was supporting us then. But yeah, so I think it was busy, wasn't it? And a different sort of event, and it's good for us to be at different sorts of events.
You can having those conversations, those healthcare, self-care conversations, and allowing that people that little space and that little time to think about themselves. So yeah, it was really good.
And just moving on to the last couple of slides then, I mean, we've talked about partners. Community pharmacy has played a big role as one. And moving on from that, just a final thing really to say, we have a bit of a toolkit. It's quite funny because I put this together last week and I was thinking, what goes in our toolkit? And we've got a box, and we've got some chairs that we borrow from a place, and we've got our equipment, and we've got our printer, we've got our banners, and we've got our flyers, and we work closely with the Stroke Association. We've been connected with the AF Association too, so we've made some really good relationships, and a ball of string. Always need a ball of string to help us tie things together on the day and keep the gazebos in place. We are in West Cumbria after all. And just moving on from that, lots of learning I think that we've talked about already. Starting conversations in places where people are, where they know that community energy makes things happen. We have people on our group who know so much about the local area, so it becomes very social. Those events, we enjoy them. The support from NHS and public health, absolutely integral to helping volunteers, supporting volunteers to getting out there. Community pharmacy I've talked about. Keep it open, new ideas, new people to join. Seen somebody put something in the chat today about joining us. Always welcome, really. We love people to join us. We've got some retired people join us, some unretired people join us. Moving with the energy, sort of don't miss the point about what you're doing. Things can be structured or unstructured, but if people invite you to things, we tend to go. And Georgina, I don't know if you want to say anything about the other things, because there's a couple of points there about clinical buy-in and things like that. But really looking after each other, that's been something, and that's something I want to say. As a group of people, we really look after each other. So that's an important ingredient.
I think it is important to note that when you start doing these things, that none of it's easy, and it is a challenge, and there are obstacles to overcome, but you do get there. And clinical buy-in was tricky for us. We had support, but that yes, it's a good idea, and yes, you do this, but actually when we needed that clinical buy-in to enable the blood pressure checks to happen, that was tricky. And we did have big plans to do loads and loads and loads of events, but we couldn't get the clinical staff to support us, just because of capacity. So it feels like as I say, COVID, and we could have stopped, but we didn't. And there are several points along the journey where it's been difficult. and we could have stopped and we could have said, well, we'll just do AF testing. But things have changed, the environment's changed, the climate's changed, the way that we work with our partners has changed. And I think that is thanks to COVID, because we're all in it together. And that's how it feels, that nobody in this group is above or better than anybody else. We all have a really key part to play, and everyone's equally important and everyone's equally valued, and I think that's probably one of the things that keeps us going, and that we all care. We've all got that personal commitment to this. We care about this. So yeah, I'll probably shut up.
Last slide. Becky, you'll be pleased to know, being as we've taken up double the amount of time I said we would do. If you want to come and meet us, this is some of us. If you fancy a day trip to Whitehaven, we'll be there on Friday the 8th of December, all wrapped up between 10 and 2, doing what we've just told you. Thank you.
Thanks.
Brilliant. That's great. Really good example, like I say, of like kind of highlighting this approach, the use of volunteers and champions in practice. We are running a little bit behind, but
Sorry.
I think, like I say, testament to the passion and the really good work. So if anyone does have any questions, please put them in the chat and we'll try and pick them up either if we do have time at the end or in the chat. Just really quickly, if you just move on to the next slide, please. I just wanted to cover one slide summary of just some of the work that we're doing in terms of next steps. I will just run through this really quickly. So we're continuing the network, bringing all of the local authorities together, continuing to sort of share practice, build on the learning set like we've already talked about. Just a kind of example of some of the opportunities where we're looking to kind of collaborate and do things sort of where we can do things once rather than kind of repeating in lots of different areas. We're looking at the development of a junior champion program. This is something that has been trialed in a couple of areas, but there's appetite to kind of do that regionally. We're trialing the use of what we're calling conversation cards to really look at how we evaluate the reach and the impact of the programs. Again, sort of building on, this is something that is a bit of a sort of challenge. We're doing some work in a couple of areas with Northumbria University around an evaluation piece with a particular focus on kind of who are the trusted voices within the community and that kind of impact on misinformation that was particularly apparent within the pandemic. And then this kind of links really nicely to what Charlotte and Georgina have just talked about. We're doing some work with the Academic Health Science Network on a CVD prevention program across the region using a champion-led approach. And again, around how we kind of build on what we already know, we're really keen to learn from the Cumbria work and how we sort of share some of that, the toolkit. So I'll be coming back to you on some of your tools and resources and how we can kind of weave that into the work that we're doing across the region. So that was just I guess just to sort of emphasize that this isn't going to stop here, that we're kind of building on what we're already doing. And that's a nice segue into Richard's bit, because we have some news around some funding that we've got to put towards some of this as well.
Thanks, Becky. Yeah, so as part of our funding, we're able to provide a small development fund, really to try and build on the work that's already been done and encourage more programs across the region. So the aims of this are really to encourage new programs and build on the learning that we've already established through the work so far. And we really want that to be grounded at local level, and we want it to be helping to fund partnerships between the voluntary sector and the local authorities. So the funds will enable that to happen. They will end up with voluntary sector. We are a voluntary sector organisation. The funding will go to voluntary sector, but it needs to be in partnership with the local authorities. And our pot can fund a small number of grants. The maximum we think we can do is £10,000 per project. and we'd like the focus of those programs to be on an aspect, at least one or more aspects of Core 20+5 priorities. And we'd like to see those projects apply some of the learning that we've put into our learning set. So we're about kind of spreading that across the region. And we'll share details of where you can find the information about that fund when we send the email out following this webinar. So the information will be on our Health Champions webpage, and we'll share the link to that. So hopefully that's some good a good resource to help this maintain the progress in this area. Yeah, so hopefully we've now got a few minutes to take some questions if people have some after all of this information. I'm sure there are some questions that people would like to ask. Becky, would you be able to spot any raised
Yeah,
hands,
so
please,
actually we've got a hand up. So Julie, do you want to come in with your question?
Yes, thank you. Absolutely fantastic presentations, and I loved the case study from Cumbria. It was absolutely brilliant. We are already trying to explore the role of health champions in the promotion and the support of the NHS health check. So I was really keen to hear and just to explore a little bit further about were any of those people that you engaged with and all of those fantastic events, were any of them actually signposted onto their GP for the full health check?
Yeah,
That's one for you, Georgina.
yes. Yes, yeah. So in those, the AF conversations are the conversations where you can have that, because as you're generally kind of calmly talking to someone. So those are conversations that we ask, have you had a health check? If they're eligible for a health check, would it, if not, would it be a good idea? It's probably a good idea if you go and do this. Or, I haven't got time. Well, I think you need to make time. And so, yeah, those conversations will happen, but it is very informal. We very much have the AF and testing and those conversations with the volunteers who are about. Although we're side by side with the clinical person who's doing the blood pressure checks, we kind of keep it so that we're the more social bit, and that's the more clinical bit. Because and I was just typing in the chat because there was a question about the BP results and the clinical data system, and Charlotte answered that saying, well, no, we have a paper copy, but if somebody's hypertensive and they're undiagnosed, so they're not on medication and they don't know, we refer to community pharmacy for 24-hour monitoring. So we've got that in place now, and also what we've done at these events is I can't always make the events, and there's been some that I haven't been at, but we have a GP on call. So that we've got the mobile number of the GP, so that we can actually, if we have anything that we're worried about, we can ring the GP and talk that through. So
Fantastic.
Yeah.
Thank you. Thank you.
And I think can I just come back on that? Just thinking on that. So when you're saying about the champions for the health checks, and obviously I work in public health, so health checks is part of it. I don't lead on that, but a colleague leads on that. And I think it's really tricky, because the thing about this is you can have a passion for this, and you can say, like I do, my dad died from stroke, my mum had AF. And you can make that personal connection, whereas and cancer's the same, anything like that, anything that's a specific focus or a disease focus or whatever, but health checks is really tricky. So I think that's a very good point. So yeah, I think we'll take that back to the group, Charlotte.
Good. A couple of things there that would take back to the group.
Yeah.
It's very informal. and people come to it. We're surprised. I'm always surprised how many people come up to our gazebo, and people nudge people, and they come in at the beginning, and we do a little bit of, you know, welcoming people to the Traders Fair, for example, and then saying, come and have your blood pressure taken, and they look at us a bit funny, and then quite often come back a bit later when they see there's a few people around and things. And we have a few regulars now, which sounds like not really a good thing, but it is a good thing, because we have people that just come up for a chat, and we know sort of who they are in some places, and they're chatting about their health generally, their lives generally, and I think the partnerships are key too, and Copeland Wellness Service, which has probably now been renamed as well. I think we're going to be sad to lose our Copeland banner.
Well, we won't lose Copeland Wellness Service, because they are Copeland PCN, so that's the social prescribing
excellent
service attached to the
and they
PCN, so
they
don't worry
provide,
about that.
in a way, we're like bits of a puzzle, and since they've been on board, they kind of provide the bits that we don't. We're very careful, so if we're not clinically trained or qualified, we're very careful, and so far that's worked really well.
Yeah, and I think as we develop the CVD prevention approach that I mentioned across North Cumbria, you know, these are some of the things that we're really keen on, you know, taking the learning from what's already happened, and then how we kind of develop some of those links into primary care, the links with the health check and things. So yeah, I think this is all really kind of interesting conversation and things that we need to kind of explore further. So there was just a question in the chat. I think, Charlotte, you might have answered it, but just to kind of pick it out. So are your champions part of a wider programme of champions who all have different specialisms or areas of interest? So if you just could clarify that.
I mean, we're not, no. It made me, it prompts me to think maybe we should be.
I think we have opportunity to. I mean, the thing is, we think about this as Copeland Community Stroke Project. We don't think this about stroke champions, do we?
No.
And it's only when actually other folk, and you know, Becky talked to us and thinking, well, oh yeah. Well, I guess that's what it is, and you know, you're championing because you're promoting and you.
I mean, we're known about now because, you know, in our area. So we're known about in Cumbria, in North Cumbria in particular. We're connected to the stroke ward in Carlisle through the stroke discharge coordinator and everything. So we are connected wider than our area, but not into anything specific like that. No.
But yeah, another point to take back, Charlotte.
Yeah, and I think because I guess everybody came together for a very specific purpose, you know, which was, like you say, around that kind of personal connection and you know, the kind of interest there. I guess, you know, like we said before, it was like COVID presented that kind of hook to get involved. You know, that was a very specific kind of topic, wasn't it? So
yes.
And I think it's worth saying, sorry, I'm just commenting on that. It's worth saying we're not, as a region and as a project, we're not trying to kind of push people into our way of doing things. We're very much about building on what people are already doing.
And you know, I certainly, I wouldn't want to do anything that would put people off this, you know, doing this, or do anything that would think that it was being diluted. And I think, you know, that like the cancer champions, you know, that works. I can see, you know, the you know, cardiovascular or the heart champion or whatever, you know, if it's slightly different. And I can see, you know, you can see the connections, can't you, across. But you know, I think as local authorities, we often we often try to think of champions for everything, don't we? And I can remember a few years ago an email going around, a staff email going around saying they were looking for snow champions, and you just think, oh, for goodness sake. And if you're a snow champion, it means, you know, you get some wellies and some waterproofs and a big shovel, and you clear snow from people's paths. And just so yeah, I think that's probably where I would be thinking, you know, we just need to take a breath and you know, think about what we do.
Yeah, definitely. And I think, you know, that's what the learning set kind of recognises, that the approach is different in different areas, like I say, very much dependent on the different priorities in different places and the different communities, and yeah, and very much the learning is that the champions have to be kind of interested in the topic themselves. And you know, that's what yours has shown, hasn't it, that's why people wanted to get involved in it, because it's something that's a
right.
kind of personal interest to them. So
Yeah.
well, we've just got a couple of minutes left, so I don't know if it will take any final questions, or we might just want to draw it to a close there.
Could I, before we finish, can I give a quick plug to an event coming up, because we've got VONNE's AGM and conference coming up on the 16th of November, and I think Tom will drop a link into that, so if that's of interest. It's going to be focusing on AI this year.
Well, I don't think there's any more questions, Richard, so
Great. Okay, well, thank you very much for coming, and thank you for the presentations. They were great, and yeah, we'll send out the follow-up email shortly, and yeah, have a good day.
Thanks everyone, and thanks Charlotte.
Thanks, Georgina.
Big
Thanks,
round of
everyone. Good to meet
applause.
you.
thank you.
Bye.
Thank you very much. Bye-bye. Bye.